you. Take care. All right. Well, we're going to shift gears a little bit here, moving away from the conversation around steroids and the future of steroids. We're going to talk a little bit about wellness now. And clearly, we've got things going on here in 2020, which are impacting our wellness. So the title of this talk is, what does wellness look like in a pandemic here? And we're delighted to have Dr. Callabrese, Dr. Leonard Callabrese, present on his thoughts around what wellness looks like in the age of pandemic. Dr. Callabrese is a graduate of the Kansas City University of Medicine and Biosciences. He performed his internal medicine training at the Cleveland Clinic Foundation, followed by a fellowship in rheumatic and immunologic disease. He has been on staff in that department at the Cleveland Clinic Foundation since 1980. Dr. Callabrese is a professor of medicine at the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University and vice chair of the Department of Rheumatic and Immunologic Diseases. Dr. Callabrese is the director of the R.J. Fassenmeyer Center for Clinical Immunology at the Cleveland Clinic, specializing in diseases of the immune system. He holds joint appointments in the Department of Infectious Diseases and the Wellness Institute. So welcome, Dr. Callabrese. We're delighted to have you here.
Hey, thank you. I was flattered to be able to help out. Can you hear me and see my slides? Okay, great. So I want to switch gears with you. Can't think of a better topic for this point in time in life for patients with immune-mediated inflammatory diseases than right now to talk about wellness. I'm going to start out with a little bit of self-marketing. I think that if you really want to follow immunology and wellness, the science, getting ready for ACR 20 right now, the meeting has been transformed by Twitter, and we're very active in Twitter and the scientific basis of wellness. So please follow us along. So when I say this, let me kind of give you the 30,000 foot view of what I'd like to talk about in the next 30 minutes. I'm going to talk about COVID. I'm going to talk about wellness. I'm going to talk about what you can do to enhance your wellness through the lens of somebody with an immunologic illness. And this is really about the empowerment model of immunologic health. I just made this morning. It's pretty depressing. This is the global COVID map of the world with almost approaching 50 million patients. Here we sit over here, the most advanced country in the history of the world with the greatest number of cases. It's travesty. This is a disease that's formidable in healthy people, but people who are immunocompromised have more to think about. So that's one of the reasons that we're so interested in the topic of immunologic wellness right now. So let me just make a point about COVID, because this is a confluence of both an immunologic disease and infection. You know, most people get this infection and it's self-limiting in 80% plus. About 10 to 20%, it becomes severe and it's fatal in a few percent. This is the clashing of the infection with the time course. And this is 14 days. And this is where 80% of people will get better. It engages our immune system, antibodies kick in, T cells kick in, and we get rid of the virus. But if you're older age, Black, Hispanic, obese, cardiovascular risks, immunosuppressed, we go on to this third phase that's characterized by a lot of inflammation, and it produces something that people have called cytokine storm, cytokine release, and many of these are the same immune mediators that are functioning in vasculitis. So it's not surprising to see what's going on here. What triggers the immune response? Well, we always thought that it was foreign antigens, and that's true, anything foreign to our body, but food's foreign, that doesn't do it. We thought that infections were the answer for many years, but now that we know about the microbiome, we are covered and coated with bacteria, fungi, and viruses. And the current view of our immune system is it's triggered by danger. And our immune system has an uncanny ability to recognize when something is dangerous and not dangerous. And that's what triggers us. So the immune system is organized. We have, coating of our skin and mucous membranes that helps. We have this early warning system called innate immunity, and our adaptive immunity, that's T cells, B cells, and antibodies. We use all of these in infections that last for more than a few days. And this is what we're talking about tuning up. Inflammation is the fuel that drives this. This is the patient with leukocytoclastic vasculitis. This is inflammation. And inflammation can be helpful when we're repairing a wound, and when it's uncontrolled and causes vasculitis, it's bad. It just so happens that chronic low-grade inflammation is the driving force for many non-communicable diseases like diabetes, heart disease, stroke, that is attributed to over 50% of all the deaths on the planet. So this is something that we're starting to take a much harder look at. What makes us vulnerable to infections? Well, exposure, time, duration, and route. That's why we wear a mask. That's why we stay away from people for 6 feet. Do we have immunologic memory? Have we had a vaccine for it? Well, not for COVID, but for the flu. That's why we all need to have our flu vaccines. Is our immune system compromised? And that could be because we're on drugs like glucocorticoids or cyclophosphamide or rituximab that inhibits our ability to fight off infections. Unfortunately, when we get to be old, our immune system starts to run down. That's called immunosenescence. So some of these things we can do some things about, some of these things that we can't. I can't make too much of this. There's just some common sense here that if you want to read a great book about the pandemic, read The Great Influenza by John Barry. This book has been written about 14 years ago. These lessons are as important today as it was 102 years ago. So now let's talk about, with that background, when I talk about immune health, when I talk about immune strength, I talk about it from an evidence-based perspective. And I want to tell you that we are not hopeless. Healthy living and the right behavioral choices, these are the cornerstones of immune health: how we eat, how we exercise, how we sleep, and how we handle our stress. I won't talk about this, but this is axiomatic over here. This is telling us, before we start thinking about what kind of diet we are, we need to quit smoking. We need to avoid carcinogens if at all possible. We need to not poison ourselves with drugs and alcohol, and do the best we can, even if it's starting at day 0, to manage our weight, because this is a driver of inflammation. Let's talk a little bit about exercise. Patients with vasculitis, one of the major things that we're all concerned about is lowering our risks for infection. And this has been shown by my friend David Neiman 20 years ago, that moderate exercise, not being sedentary, is a great protector from chronic recurrent respiratory infections. Our immune system works pretty good to protect us during a given cold and flu season. But if we are highly sedentary, we're not getting any activity at all, the risks are elevated. Just with a walking program, getting our 5 to 1,000 plus steps a day, if we can get a few days a week that we get 10,000 a day in, we can drive our risk of respiratory infections down by 40 to 50%. I'd like to make the point, and I don't think we need to worry about this, that there is a point in exercise where it becomes too much and our risks are elevated. These are people, ultra marathons, and maybe some high risk for some, but not for others. So it makes the point. We talk about people, the importance of exercise. You know, if you're not doing anything, you've been sick, you're sitting on the couch. We take, 1 minute, 3 minutes, 5 minutes every hour to get up and move. In fact, randomized controlled trials have shown that people that go to the gym 30 minutes in the morning versus those that just get up and do brisk walking 5 minutes every hour for 5 hours a day, the walkers have greater health benefits. So you can do it. I just show you this new article this year showing the amount and intensity of leisure time physical activity for risks of a variety of cancers. This is a risk of 1, looking at this line here. If you go up over that line, your risks are increased. If you are below that line, your risks decrease. So look at some of the major ones. Gastric cancer, people that are getting just modest amounts of exercise. This is very, very achievable. Can drive their risks down. And same for kidney, esophageal, endometrial, breast, myeloma, liver, all of them go down. We don't emphasize this enough. So just getting our 150 to 300 minutes of brisk exercise, that means just walking and beyond, very, very important. What about nutrition? There's never too much talked about in this area. I mean, it's everywhere. First thing I'll point out to you is that the Western diet, the standard American diet, I call it the SAD diet, is inextricably linked to inflammation. This is also linked to the epidemic of obesity in our country, and that is tied into being sedentary. We now understand many of the mechanisms that drive this inflammation, but diets that are rich in stripped carbohydrates, diets that are rich, that's sugary drinks, unrefined flour, bad choices in fats, all contribute to this. What do we do? There's nothing talked about more than diet. And there's all this bug nutty stuff out there on the internet that, tempts us and taunts us with quick fixes. Let me tell you one thing about this whole talk about achieving immune strength and immune health. There are no quick fixes. There are no tricks. There are no magic answers to this. But a steady course, a middle path can do this. In our monograph, which I'm going to offer to each of you, and Joyce is going to post the website that you can download the monograph that I give every single patient that comes to our clinical immunology center. We start by saying, eat the rainbow. And if you have a terrible diet, you can start slowly, have a meatless Monday, increase the veggies, decrease the refined carbs. The mantra that we say, that we have stolen and ad-libbed a bit is that eat food, like real food, not something that your great-grandmother would not have recognized as food in some kind of box that sits on the counter for 6 weeks. Mostly plants, but you don't have to be a vegan to do this. And try not to eat a lot. In the longest lived populations in the world, there's a in Okinawa, Japan, they say hara hasibu. You eat till you're 3/4 full, and that is an excellent guideline for portion control, weight control. Whether you're a vegan, whether you're a paleo, whether you combine these, my friend Mark Hyman says, be a pegan. 3/4 of your plate is good, heavy, vegetable driven, and 1/4 of your plate is the protein. A lean cut of meat, grass-fed meat, fish. You can do it. Pretty simple, actually. What about supplements? You know, I'm not a big advocate of supplements. We want to avoid trace nutrient deficiency. There are certain things in our diet that are very important for immune health. Are we getting adequate vitamin C, vitamin D, and zinc? A balanced multivitamin is what you need if you're on a strata where you're not having adequate dairy, or your vitamin D levels have been documented to be low. 1,000 to 2,000 units a day is fine, but adding on massive amounts of these is really nowhere. I wind up here with a few comments about the immune system in your brain. When I talk to people, you know, I see patients with vasculitis, I see patients with immunodeficiency, I see patients with HIV. There's not a patient in the world that I've ever talked to that, given an adequate amount of time, won't ask, what else can I do? You know, I'm going to take your medicines. We're on the same page here. And you know, but what else can I do to achieve wellness? You know, you might say, what is wellness? Well, it's not just not having a disease. There's a lot of people that don't have diseases that are terribly unwell. So we say it's, you know, achieving a balance of body, mind, and spirit. I say, you know it when you see it. You know, when our lives are going well, that's what wellness is all about. So brain and immune system are one organ. They are not two organs. And if you don't appreciate this, you'll never be well. You know, this whole field of neuropsychoimmunology over the past 25 years has taught us a lot. I told you that this, what triggers the immune system are infections and danger signals around us, but also there are danger signals sensed by our brain. You know, stress, PTSD, loneliness, fear, all of these, when they are not processed, have the ability to link with our immune system and drive inflammation. We actually know that our genes are altered, the way they function in people that are chronically. And accordingly, things that are regulated by our brain are important for our immune health. The chief nourisher in life's feast is slumber. And I will tell you that if we posted cholesterol levels, it wouldn't look as bad as having persistent insomnia. And here you can see all-cause mortality. You know, people in green sleep good. People in blue have partial insomnia. People in red over 20 years correlating with insomnia. And, you know, if you need help, in my monograph, I talk about, you know, cognitive behavioral therapy for sleep. We have some online programs that we steer people to. So if you're not getting sleep, which very few of us in the COVID era are getting, you need to work on it and work with an expert, get resources. Stress directly impacts your immune system. Same stresses that sleeplessness drive increased inflammation over chronically. You know, our brain is connected to our gut. We say we have a gut feeling. We do have a gut feeling because our brain and gut are connected. We have an autonomic nervous system with the sympathetic and parasympathetic branches. And now we're manipulating that in inflammatory diseases. You know, these vagal nerve stimulators, people talk about the vagal solution. I'm involved in some research stimulating vagus nerve in people that are failed biologic therapies in rheumatoid arthritis right now. It's fascinating, and we're at early stages, but it's looking interesting. Well, you don't need a vagal nerve stimulator. You can hack this with mind-body therapies. We call them top-down and bottom-up. The bottom-up involve physical exercise. That's why I love Tai Chi and yoga and Qigong. And anybody at any age can do this. There are abbreviated programs. You need to find a program in your area that is, you know, for people that, you know, are not trying to do the 120-step program. And there's very simple programs, abbreviated programs. There's even seated Tai Chi, seated yoga. This has been shown to buffer our immune system. And then finally, mindfulness meditation, probably the most powerful behavioral modification. And you might think that this is wacky or way out. I've already been doing research on how mindfulness can lower inflammation, and we have some online resources for you to think about. This is just a recent study, a so-called meta-analysis of 25 different studies showing that the capacity to lower inflammation is shared across all of CRP, IL-6, TNF. These are the same things that we're targeting in vasculitis. So, take your medications, do the best that you can, and then add to that. So at the end of the day, I tell my students when we're talking about wellness, how do we build our immune strength? Well, there's the easy town. People would say, well, I'm going to take that vitamin. But that's really not the way of the world. We have to walk a longer path, a more challenging path, and eat right, exercise right, try to get our sleep optimized, and try to buffer and parse our stress the best that we can. Now, this is all a tall task for a 20-minute talk that I've been giving you, but there are ways to do it by starting out, a moment at a time, a day at a time, a meal at a time, a breath at a time. So this is a resource I would love all of you to partake in. This is a monograph. It's 25 pages long. It's divided up into a kind of a primer on how your immune system works, how behavior affects it, and then we talk about eating the rainbow, instant recess, starting your exercise a minute at a time, how to get that slumber that you're looking for, and finally, how to use online programs to parse your stress. This is a website that once you get the link, you can go to it. It's our Cleveland Clinic CME program page. I'd love for you to take in whatever you want to. There's some interesting lectures about exercise immunology and beyond. And just hit this download your free copy. It's a PDF, print it out, save it, whatever you want. I talk about it a lot on Twitter. This is what we're doing. So those are my comments on wellness in the era of COVID, wellness for patients with immune-mediated inflammatory diseases, wellness for patients with vasculitis, and wellness for all of us.
Dr. Calabrese, that was fantastic. Thank you so much. If you could please leave that slide up for a second. I think there were a couple of folks in the Q&A that wanted to copy down your Twitter handle. And,
oh, yeah, please.
Yeah. And so, yeah, if you could leave that up for them, that'd be fantastic. And I guess, Joyce, if you're there, is that going to be in the resource section in the conference hall? Do you know?
Actually, Sarah, I'm going to be emailing it out to everyone.
Perfect. Perfect. All right. Well, thank you so much. I mean, this is such incredible information for us as we are on this Join Our Journey theme here for the conference, and things that we need for our journey. And you're right. I mean, it's definitely needed.
Let me close by saying, I feel very strongly that our recommendations are A, evidence-based, B, designed to go with your therapies and not compete with them, and C, are scientifically accurate, and if you do them, I guarantee you will have some positive effects.
Absolutely, absolutely. And I think, even for those of us that have tried to do it, we need to be reminded of it constantly. So thank you. I speak for myself here on this one, at least, is that sometimes I need that reminder. So thank you so much for your presentation.
Okay.
Glad to have you. Thanks so much.